Talofa everybody, malole, kia ora tātou katoa, and welcome to New Zealand Rugby Women's Health Talanoa. Kōrero, conversation, we're going to have a bit of a chit chat, and this is the place where we are going to talk about real women's health in rugby. I am Vania Wolfgram. We are so excited to be here, and thank you for joining us today. So let's get into it. Let's be honest, for the longest time, these topics have been around women's health, have been tapu or taboo, not spoken, hidden. And that's why we're creating a safe space today, just to open up our conversations, build some confidence and learn more together. So it's not about having all the answers, because I really don't know them all. It is about sharing our experiences and getting curious about the stuff that really matters for our wahine and our young wahine in rugby. So to join us today, who will have the answers and some questions, we have treated to an absolute amazing panel of expertise for our Talanoa and our chat. Black Ferns Dr Alyse Cameron. We have Emily Carter from Her Strength, and we have sports physio Maumahara Keelan. Thank you for being here today. Really excited to have you. Yeah. So just to start us off, can we get each of you to just introduce yourself briefly and maybe share how you're connected to rugby or how we're connected to supporting our young girls in sport? Might start with you, Alyse.
Yeah, cool. Thank you. Kia ora everyone. Thanks for having me here. So my name's Dr Alyse Cameron. My medical specialty is sports and exercise medicine, or more commonly known as a sports doctor. I live down in the Hawke's Bay with my husband and 2 young children, where I work in a private practice, predominantly seeing people from the general population with injuries or ailments or things that need input on. And then my link to rugby is I'm the team doctor for the Black Ferns, and within this role I look after the girls or the wahine, their medical issues, their injuries, their women's health, keeping all of that afloat in order to keep them on the field doing what they do best, which is play rugby.
Yay. Tēnā tātou, e mihi ana ki a koe Vania, e mihi ana ki a koutou. He uri tēnei no Ngāti Porou te whānau apanui te whakatōhia hoki, ko Maumahara Keelan tōku ingoa. Kia ora everyone. Yes, my name's Maumahara. I've been a physio for a long, long time. What brings me here today is I've got a real passion for female wahine in sport, especially from a cultural lens. So I have worked in physio for almost 2 decades. I have seen everything from hospital right through to elite sport, through my lens, through a Te Ao Māori lens. I'm a proud mum with 3 daughters. I've got 2 older sisters. I come from a huge long line of strong wahine, from Ngāti Porou to whakatōhia me te whānau apanui hoki. So hence the reason why I'm here. I retired from physio last year, and it's time for me now to share all this experience to communities. How can I get it out to hapori, iwi, hapu? And this is why I'm here. Best space.
Nice, Maumahara.
Kia ora.
Cool. Hi, kia ora. I'm Emily Carter. I'm here today. Well, firstly, I'm really honoured to be here today. I think it's such an important conversation, and I'm really excited to talk to these experts in the room here as well. My experience and why I guess I've been brought in is I did a PhD in paediatric strength and conditioning, looking at our youth and how they develop physically, and I've been involved in high performance sport for over 15 years, predominantly in tennis. I'm currently the head of high performance for Tennis New Zealand, and I also work with my friend and fellow PhD in physiology, Julia Casadillo, who started Her Strength, and this a really cool educational platform designed to help keep girls in sport. And how we can do that, we can talk to some of that stuff today, which is such an important message. So thanks for having me.
A very powerhouse panel, if you ask me. Thanks for being here, everybody. we're going to kickstart off with a goodie. Like when we talk about puberty, particularly in the context of rugby, what does this mean to you? And I think, with rugby, we might go to you, Alyse, first, and then we'll, just chime in whenever you feel like, Alyse.
Yeah, I think puberty is a challenging time for an adolescent. We know in the research that by the time a young wahine is 14, that they're dropping out of sport at twice the rate of their male counterparts. And this is something that we need to look at ways that we can change this, not only for their physical benefits of playing sport, but also the mental well-being, the social side of sport, and getting them in there to play. So I think it's an area that we need to work on to keep people active and keep people in sport.
I think from a cultural aspect, talking about puberty, talking about this topic can be taboo. We don't really speak about it. I know growing up, I didn't really speak about it, even though my household's full of women. We'd have like little banter, but it wasn't really spoken. And so going into like sport, I was too shy to actually talk about it. But I suppose today it's really important to normalise it. It's normal to talk about puberty. It's normal to talk about our periods. It's normal. Trying to normalise it gently and support
a normal
others.
part of growing up.
That's right.
Yeah, I can resonate with that because I know growing up it wasn't a conversation that we had at home at all, which is probably quite common for, someone like me. So, Emily, why is it important to have these sorts of conversations, especially when our girls are coming through, playing all the sports?
Yeah, I think for me, in my experience, I've worked with children and young adults all from 6 all the way up to late 30s now, or older adults, youth adjacent we call them. But we have these all these changes going on, and we don't really acknowledge them. So especially during puberty, there is physical, emotional, hormonal changes going on, and yet we carry on sport as if nothing's really changing. Coaches don't necessarily address it or consider it enough, and we really need to change that to keep the experience, especially for our young wahine, to be enjoyable and to actually be able to learn about their body and accept these changes as normal and part of growing up, and it's not going to be a smooth progress upwards. There might be some little dips, there might be some steps backwards before they can go forwards, but that's totally okay. And once you know that, it's much easier to manage, and that's why this conversation is so important.
And when we're trying to understand puberty, and it's really cool that you touched on that, Emily, like there's a lot of changes. You talked about physical changes, emotional changes. Alyse, can you talk us through what's actually happening in the body at this, sort of stage of our girls?
Science time. You want a science lesson? Yeah. This is what I love. This is where I'm at. Okay, so puberty. It all starts in the brain. It starts in an area called the hypothalamus. The hypothalamus sends a message down to the pituitary gland to say, hey, time to wake up, time to start puberty. Okay. Then the pituitary gland sends messages down to the ovaries or the testes to say, let's start producing estrogen, let's start producing testosterone, let's get this process underway. And that's basically the basis of puberty. And those people with ovaries, they start getting breast development, periods will start, so change in fat distribution around their body, hips will be widening. For those with testes, the testosterone will deepen the voice, there'll be an increase in muscle mass, there'll be an enlargement of the genital organs, there'll be hair on the chin and the armpits, those sorts of things. So these are the changes that each sex has. Everyone that goes through puberty will have a growth spurt. That's normal. There may be oily skin, there may be acne, and there may be mood changes. And this is happening because through puberty, the brain is actually rewiring itself to take in all these changes and move to an adult body. We know that puberty varies for everyone. Everyone goes through it at a different time, but on average it's somewhere between years 8 and 14 that people start this process and the brain chemical reactions and processing starts happening. So that's your Science 101 of puberty.
Wow. You just went like this to this. Hey, wow. Maybe open to the floor. So we're looking at these changes, and they could be, breast development, growth spurts, as you just mentioned, the starting of periods. How do these affect our young, players, our young wahine move? How do they feel? Like, how does it affect their performance on the field?
Hey, I think, touching on that, you forget that, especially if I talk from a Māori Pasifika viewpoint, these children are carrying they've got responsibilities at church, at home. They may have jobs too, helping financially bring money into the family. So you're adding that on top of all these changes. It's a scary place to be when, I've got all these responsibilities now. I can't even fit this thing, or my body's changing. Yeah. I'm a bit grumpy and I'm getting a little bit more angry at people, but just knowing that life outside does not stop as well. So, it's hard work going through puberty. It's hard. You've still got to juggle sport, school, family, church, work if you have to, but siblings, cousins,
big family,
father,
and learning how to navigate a new body in a way.
That's it.
You may not be able to run as fast as you used to. You may be a bit more uncoordinated, tripping over, clumsy, those sorts of things, and learning how to adapt with these changes.
Yeah.
Yeah, and as you said, we haven't really had that. We haven't got into the culture of having these conversations early enough so that young girls know what's coming. It can be almost too late when we have the conversations. Oh, by the way, you've got your period. This is going to change. It probably already has. And so maybe they've been dealing with that on their own and thinking, God, why is this happening? Why do I feel slower? Why am I so tired? I used to do this training easily, and now I'm really struggling. But no one's had the conversation beforehand, whether that be coach or mum or dad or anyone in the family that's going to give them that information they need to be like, okay, I understand why this is happening, and give them the tools to then manage those things where possible,
Speaking of tools, Emily, what are some tools that our coaches or parents or teammates can actually provide our players when they're going through these changes, knowing that they happen at different times and different rates? So do you have any?
Yeah, well, I think knowledge is power first and foremost, to enable them and empower them to do what they do their sport in a way that they understand their own body. That's if we can educate to give them that sense of understanding, I think that's a really important tool first and foremost. And it's not just for the players themselves, it's for the parents, especially with considering these are children still. So parents and coaches have a huge role to play in making sure that they are doing their part in the sport journey, because the kids might not be at a place where they can understand that they're doing too much or they need to rest more. So I think a clear, open pathway of communication between your team around you, and the more you move into competitive sport, that team gets bigger and sometimes more complicated, and the messages can get lost. So clear, open pathways of communication are a really useful tool to use.
So Em just spoke about knowledge, so really maybe leaning into that space to try and find out some more. And then you spoke about communication, clear comms. Is there anything else, Maumahara, that you think could help?
Yeah, to communicate, you need to feel safe. So safety, haumarutanga as I call it, for a young person that's going through all these changes, they've got to feel like they're comfortable talking to. I can talk to my teammates, or I can talk to my mum and dad about this. So I think having that around them and being safe in those environments, that they feel confident. Sometimes you might notice, you might have our little Pasifika Māori girls, they kind of congregate together because it's a safe, and that's okay, but at least they've got someone to talk to. Be aware of, you'll have individuals that are by themselves. Be aware they will shut down and they won't speak about it maybe. But a safe environment would be good to optimise communication.
Yeah, I agree. I think making sport a place where it's safe, it's allowing confidence building, it's allowing resilience in the wahine that are there, And as well, I think there needs to be a bit of a shift of, we know this is happening, we know the individual's going through all these changes, so maybe instead of making this a really competitive environment, let's make it more of a focus on, hey, we've been there, it's the effort, you're turning up, you're putting in the mahi, you're actually doing the work, and that's cool, that's what we're trying to achieve, rather than results driven at that young age, making it fun, making it connected, and allowing that safe space as you talk about.
It should be fun.
It should be fun at that age.
Celebrated during that stage.
Yeah.
We should be playing sport for enjoyment, to stay there for, add those, set those foundations really firmly. So that's probably the important part for coaches and managers, is have a supportive, really encouraging environment. For family as well, family included into that as well.
Yeah, I love that you touched on fun, because I think fun can be missed at a higher level, but fun should be across all sorts of ages, teams, not just rugby, all of our sports. So, and it can only be fun if the environment's safe. So I resonate. There are some when we're looking at common signs, I did hear. Is it clumsiness is one of them, or fatigue? So what are some of those signs that our coaches or parents can maybe identify that may sort of, that they're going through a growth phase? Are there any that come to mind? I didn't think I was clumsy when I was young. But now I think about it, I'm like, oh, maybe I was growing.
I think probably the first thing to consider is that we all go through it differently, and there's a whole myriad of different signs and symptoms, if you like, of being in a growth phase. And clumsiness can be one of them, or you can term it adolescent awkwardness, or you might have heard the phrase, they're all arms and legs at the moment, and that's because we know that we grow from distal to proximal, we grow from the outside in, so they might see a kid with big feet and they go, oh, okay, they might be about to grow, and then they get the long arms and legs, and then the trunk catches up. And in that phase, they can lose some of their balance, some of their speed, or change direction, reaction times can drop, those kind of things. So I think you have to know your players as a coach, so to know what's their normal, what's their baseline. But the other things, there could be soreness, muscle tightness, more niggles, all things that are little signs that they're growing. And then sometimes some kids don't go through that phase. They breeze through adolescence a lot easier than they're the golden, the chosen ones, and they seem to go through it pretty smoothly and come out the other side maybe a better athlete because of all the hormonal changes and things that give us the good stuff. They not estrogen and progesterone not only are responsible for reproductive cycle, but we're also talking about cardiovascular health and brain development and muscle and tendon and bone. So there's so many systems that are impacted by this. So I think the overarching message would be that you're not going to have one thing that you can look out for, but look out for a lot of things, and then you're going to be more observant and more tuned into your athletes and what's going on for them at that time.
Oh my gosh. I'm thinking about when I have coached girls and I'm like ignoring their soreness. I'm like, get on the line. I'll be more mindful.
That's what this is all about.
I'm from that era. No. Anything to add? Thank you.
I was just going to add, sorry, jump in again, but on that, I think that's about changing the environment to make it more positive and a happy, safe space is that empathy around, okay, they're going through a lot of change. Yeah, sorry about that. But you naturally, especially if they're moving into high performance or performance sport, there is that expectation that you turn up and you give your best. And sometimes our best doesn't look the same. And sometimes they might be giving their best, but actually it's not the same as it was the day before or the week before, or a different stage in the cycle. So kind of, I guess, hearing what they're saying, I'm tired. It's not necessarily laziness. It's not necessarily that they don't want to do it. They might have something going on in their body that makes actually what's going on here. And there's a number of things we'll probably talk to later that actually we could probably solve for them and make their environment and experience better because they aren't managing all the things that they need to manage during that time as well.
And I think practically from a coaching point of view, coaches need to be adaptive with what they want to achieve in a training session. If a whole group of teens turn up and they do look lethargic, tired, cranky, sore or they had a big session the night before, in terms of training, big session, then going, okay, well, this is going to be more of a skills and games session. We're going to make it fun. We're going to go back to making this an enjoyable place to be, so that you want to keep coming back and we're not getting that dropout like I talked about before. Yeah. So being adaptable in what you're trying to achieve from a coaching point of view or a parent point of view, what you're trying to achieve with your kids at this age.
Or even front-footing that and knowing that for a squad of rugby players, for example, a lot of them are going to have some experience with the drop-off in some of these physical components. So, build a warm-up that trains all of those things at a very basic level, and they do that. If they do it 3 times a week every time they come to training, then all of a sudden you've got some little micro dose of exercises that are going to build them back up, so that work on their balance or their stability, especially for girls, for that single leg stability. Get that kinesthetic awareness back if they've lost it a bit, and they're getting used to their new length of limbs, they're a bit uncoordinated. Give them the time and space on a regular basis to be able to build those back up, and then you're helping your whole team get better, because even the ones who aren't experiencing it are still going to get better. So, and as Mo said, like being able to, for the coach especially, I think that's important, that they are happy to acknowledge that sometimes the physical is the priority rather than the sport development, the skills and the tactics. That does have a place, obviously a mainstay of your training throughout your development, but sometimes we have to prioritise the physical, so you're allowed to take that step on to the next level.
Yeah, it's a perfect time to teach them about recovery, teach them about stretches. This is what a proper squat looks like. Pull back, decrease the load, tidy up their movements. That's my whakaaro before around that. It's almost like pain is like little warning alarms to like stop, let's regroup, let's educate. There's so much more that you can be doing rather than running, sport.
Ball in hand.
Fill up this cup. This cup is like recovery, stretching, mobility. Fill that one so they're kind of equal strength. Because it's always sport, and this one's really empty.
Gets left behind.
It's left behind,
When we're supporting, our players through change, how do we make sure comments about the changing bodies, even when meant as a joke, doesn't affect their confidence negatively? Because not all players will have that someone, or not all players may sort of take to that negatively as confidently.
Yeah, I think I was always raised, if you haven't got anything nice to say, don't say it at all. And that's kind of what I teach my kids as well. But I guess the reality is that you could be dealing with 2 children the same age chronologically, but biologically they might be 3, 4, even 5 years apart. So they're on completely different parts of their journey. So comparing them to their teammates, whether it's like, oh look, she's heaps faster than you now, they're well aware. They can see they're getting beaten in the sprints at the end of the session, or they're doing fitness testing, and their own scores are slipping, or that everybody else is improving. They know that. So comparison to others doesn't really help. I think giving them those long-term goals of looking to the future and trying to build them up that way is a really nice way to support them, and just avoid comparison.
Avoid comparison. Agree. Comes back to that effort. Effort's where you've got to focus your comments and discussion around that you'd put in an awesome effort there, fantastic, you did a great job out there, rather than comparing to an outcome of you were blown off in that sprint race or whatever. So absolutely agree.
How important is it to have someone solid, to confide in? Like, do they need to be wahine? Do they need to be a woman, or so that they've got someone to talk to? Is that important, especially at this age when, the world can be so mean? I think
it is super important that they've got someone that they can relate to. It doesn't necessarily have to be a wahine. It could be anyone that they feel comfortable with opening up and having those discussions with. It may be dad, it may be whoever. But I think it is important to have someone trusted and safe, and someone that's able to help navigate this time with them and educate them, like we've talked about, educate them and normalise that these things are happening, and help them through.
And I always think trust it's kind of earned. So for our
Can't force
baby,
it.
that's
No.
it.
Yeah.
So you can't just say, "I'm your friend." It's kind of
Tell me your life
just the
story.
little things that someone has done for you, and you remember that, and then they become trusting. So it's kind of, they're only babies, and then they're coming into this realm where we're expecting them to communicate, tell me about this. It's like, so it's the little things that I suppose even us as human, you will remember the person that spoke about your dad. It's like, whoa, I really like them. And so that's creating that safe space. It's kind of like, they'll create their own trust. So it's kind of like a human. It's actually who's seen them, who's recognised me, who's acknowledged my nana, who's, those little gems, and then they become like a safe space. So I think as coaches and managers, it's really important to know their family, because that's you connecting to your athlete and you're creating a safe space for them to communicate.
It can be difficult, I think, for the coach, as they're in, like it or not, in a position of power in a team environment where they might be the one choosing the starting 15 or making those decisions. So even if they have a great relationship with their athletes, they still sit above because of their role naturally. And children might feel that, young women might feel that and might not be able to open up as much. So it is important to have other people around, whether it be a parent, a team manager, or somebody who's supporting the coach, to be able to have the conversations that are needed. And I don't think it has to be a woman. I think female role models are incredibly important. And I think you're lucky, like in rugby, they have the black ferns to look up to. And I loved watching during the recent games with the BFFs in the crowd, and just how much it meant for those young girls to see their role models. And but I think male coaches and managers and any part of the support team who have taken the time to educate themselves around what a young female athlete might be going through, they're still going to be able to build that same trust and relationship that Mo's talked to, because the player can see, actually you've taken the time to try and understand. You might not be able to relate fully. Of course, you've been through puberty and you've been there for some of the things that I'm feeling. Not all of them, but you have taken the time to try and understand better and try to help me through this time. So that will give them that.
Yeah, there's a lot of talk here about trust and knowing your players as people first, that safe environment, and really that big connection piece, which I know the Black Ferns are really big on. So, Emily, when we're talking, because we did speak around training loads, and like sort of balancing that when we're going through changes and development. So, do you want to just give us a real quick overview of how training loads and physical demands can change us as players, going through those changes?
Yeah, so I think if we look firstly at sort of overall training loads, generally recommendations are we don't do more than our age in hours on a specific sport. So if we're 12, we don't want to be doing more than 12 hours a week. Some other guidelines might say kind of 16 hours overall, including other sports. And we really don't want players to be specialising in one sport before the age of 13. And if they can keep them up for longer, that's actually fantastic, because there's two sides of it. One, we see that players who do specialise early are more susceptible to injury and burnout. And on the positive side, like playing multiple sports gives you, lots of different physical development skills, but also it might be mental skills, psychosocial, lots of other benefits from staying in those sports. So I guess that's probably an overarching one. When you bring puberty and adolescence into the mix with training loads, we know that puberty is actually quite incredibly energy intensive, so it does change the demands on their normal day. And then, Mo's already talked about they've got these competing priorities to manage as well. So whether it's school, other sports, family commitments, all of these things take energy. So how we manage those is difficult in a squad situation, actually, because you've got multiple players who've got different things going on, and maybe they're playing for different teams and they've been called up for the school team, and those things comes back to communication. So whether it's the parent taking responsibility to inform the coach and say, hey, look, she's had 3 school matches this week, so she might be a bit tired on Saturday.
3 school matches.
I mean, whether that's a possibility, but
because
that's just your life. So in terms of sort of physical, we go back again. In terms of the training loads, for any athlete in any sport, we want to make sure that it's progressed in a gradual and slow way, no more than 10%, 5 to 10% in a week. and you want to be, that prevents that big spike in volume, and those spikes in volumes are the things that cause injury. So yeah, I think the physical demands that puberty brings, we've talked about them in a little space, but we could break them down into 3 different phases.
Okay.
So if we look at before they have their growth spurt, we really want to be setting them up so that they have a good physical competency, that they are able to do all the basic athletic movements well. They have good stability, and that sets them up to be able to do any sporting movement and to better cope with the changes that come for their body during puberty. During growth itself, so during that PHV, we know that they're going to, the bones are going to grow quicker than the tendons and muscles. So
What did you say? PHB?
Oh, PHB, sorry.
It's PHB.
I'm
like
geeking
me.
out here. PHB means peak height velocity, or in other words, your adolescent growth spurt. So it's the technical term for the fastest rate that you're going to grow since you're a baby before you reach adulthood. So on average, it's about 7 to 8 centimetres a year. Would you agree with that, Alyse? And some do that very, very quickly in a short period of time, and some do it gradually over the course of a year. So if you've got a good physical base or athletic foundation already in place, when you come to PHV, you're likely in a better position. Doesn't mean you're not going to have challenges, but for sure it's a little bit easier. But I guess in reality, once they have then gone through PHV, through their growth spurt, they come out the other side and you see some more of the other changes associated with puberty. So the female adipose or fat tissue being laid down, so getting heavier, hips widening, and they bring in their own physical challenges. So they put them at high risk of knee injuries and other things. So their stability can become an issue and something you need to actively work on to improve. And
There's quite a lot there,
There's a lot. Yes. I love the rule of hours per week related to the age. I use it a lot for my patients in clinic, and I think as a parent, it's not just their sports training, their after-school training. Think about what they do at lunchtime. That's running around a playground for an hour. They might walk 20 minutes to school both ways. You've got to add in all of that extra activity they're doing and calculate that compared to their age, because you're absolutely right, Emily, when they're exceeding that's when overuse injuries start to roll in. That's when the pains start coming in. That's when we start to see tendon injuries, bone injuries. So I think that's a really good rule to use.
Yeah. What are the risks then? What are the risks if they are overdoing it?
I think it comes back to the tendon injuries, the bone injuries. So we're thinking things like stress fractures in their bones, because their bones aren't able to cope with that load. So they start to break down and get little fractures there. Or like I said, their tendons start to get painful and sore, and they get things called tendinopathies. They may start to get other systemic changes as well if they're becoming energy deficient with the high load. That means they're not matching their high load with the food fueling, and then they can start to get other things going on, affecting their mood, their cardiovascular system. They might be getting sick more often, more days off school, those sorts of things. So, dialing it right back, thinking how much load are they doing in a week relative to their age, where do they sit with that, and what's safe for them. Yeah.
When we're talking about, because it's, physical load, how important is rest and sleep? And because, I don't know if...
Super important. They're the pillars. Rest, sleep, nutrition.
That's when you heal.
That's when you heal. Yeah, your brain does all of its housework overnight. It's cleaning everything up. It's consolidating all the maths you've learnt at school. Your body's healing and recovering. So, I think they can't be neglected. Absolutely.
How do we encourage our coaches to find the balance in skill development when they're going through changes? I know we've sort of added some really good gems in there, but is there anything that you would sort of add around development, fun, well-being during these years, big years of coming into change?
Keep it simple, keep it fun. Keep the smiles on their faces, keep them turning up and wanting to be there. Yeah, totally.
I totally agree. I think especially when they're young, puberty can start as early as 8. The sport needs to be enjoyable and fun. It shouldn't be too serious too soon. So whatever coaches can do to keep that age-appropriate training as fun and engaging as possible is going to keep our girls in sport longer.
Well, there's already some pieces of advice there. If you could, one piece of advice to our coaches, our parents, our players about supporting our young wahine through puberty and sport, what would that piece of advice be? I don't know who's going to go first.
I think puberty, it's a big part of growing up. We're all going to go through it, but it can really impact and affect young athletes at this time. I think for players, keep showing up, focus on effort, don't compare yourself to other individuals. For coaches, be patient, be supportive, understand these changes that are going on and how you can help. And for parents, I think stay positive and keep those lines of communication going. Keep talking, keep educating. Education's key. Yeah.
And I think for me, it's every wahine is going to go for this. This is universal. It's not.
You can't skip it.
You are not alone. Ride the wave. Ride the wave. It's a time to communicate in an environment. You can create your own safe environments, but I think it's everyone goes through it. But if you go through it like smart, like being really smart and educated by listening to these kind of conversations, you will get through it, and they'll create their little safe environments, and just make sure, ride through it with your mates, keep going, keep moving. That's all I'm saying.
I think one piece is really hard, but for coaches, I think empathy is key. If you can put as many tools in your toolbox in terms of knowledge, in terms of how you support your players, so whether it's making sure that their kit is comfortable, and we know that girls, especially in sports that put their body on show more, like a gymnast or dance, are more likely to feel unhappy with their body image and be self-conscious through puberty. You know, making sure that there's options for people, like having period kits in the team bag, and saying at the start of the season, hey girls, if anybody forgets your stuff, it's in the team bag, you can just go and grab it whenever you need. Little things that show empathy and care to support your players through puberty, I think will make their experience so much more enjoyable.
101 period kits in every single female team, any sort of team.
Bathroom, kit bags, that sort of thing. It's interesting about the uniforms, the white short movement a few years ago, where it was seen players that had to wear white shorts to train in as part of their team uniforms. That was a big dropout, or didn't want to do that because they were worried about if they got their period wearing the white shorts. So again, looking at your uniforms, what are you getting these young wahine to wear? Are they white shorts or light coloured shorts? Maybe that's a quick, easy, practical fix of let's change the colour of those shorts.
And make sure like the toolbox is available for them. They can make their own, like empower them to make their own little decisions. They don't have to, if they don't want to talk to someone, they know that
it's
the bag's there, and I'm just going to check if that's okay. I've got this, or they might talk to their mates to go get it, and that's fine. You've got it all there for them.
There's some really cool tools there around trying to be or create a supportive rugby environments, right? So that's quite easy, I feel, like to have those products, if we can, in our club rooms, in our changing rooms, and, you know, even like sort of public toilets, if they're there. We're communicating with our teams that they are there. You don't have to come to me. It's there. Having so I've heard that I love the empathy here is one key thing. I've heard like your safe environment. I love that you're not alone. Oh my gosh, we are made like this. So of course, you know, we're all going through it.
It's our superpower. I always say that it's our superpower.
It is. That's us.
I've said it too many times.
Because it's our superpower.
It is. Might leave you with one last thing before we end. I mean, there's so much to unravel. Like, I think for me as a mum and a daughter coming through, I'm going to go back and look at this recording, and I might have you guys I'll save you in my favourite list on my phone. But is there anything else that you guys would like to add?
My final thought was, we've talked about a lot of topics and themes and bits and pieces here, and for the coaches and managers out there, I think give it a go talking about this stuff with your teams. And it may feel clunky and it may feel awkward to start with, but you're starting that conversation, and that's the main thing. You're starting to normalise the topic of puberty. You're starting to give these wahine tools, and that's what it's all about, empowering them so they can be the the strong wahine that we need them to be.
Yes.
Yeah.
Yeah, so much goodness. I can't wait for round 2, guys. We'll have to fly you up. No. Okay. There you have it, everybody. We've got Alyse Cameron with the Black Ferns Doctor. We have Emily Carter with her strength. I said she's strength. And we've got the beautiful sports physio, Maumahara Keelan.
Thanks for having us.
Yeah, thank you.
Welcome.
Thank you.